You would be aware we have a very packed agenda. There are two major issues, I suppose, which are on the focus of every nurse and midwife's mind, and that would be cuts to their pay, but also patient safety and the quality of care that they perceive they can give in hospitals today. One of the main things on all of our delegates' minds is the shortage of nurses every day that they go to work, and how that is impacting on their daily work on the front line in caring for patients.
This conference is probably taking place in the most challenging time ever for nurses, midwives and public servants in this country. The conference will be overshadowed by the pay issue, there's no doubt about that. Our members rejected the Croke Park 2 proposals by 95.5%. I think they were rejected in total by 14 public sector unions. Notwithstanding that, we still have the government continuing to say that it will legislate to cut pay if it doesn't find agreement via other ways. We're prepared to engage in those other ways. Members have had their pay cut by 14% in the last 3.5 years. We've lost 14% of the nursing and midwifery workforce in the last 3.5 years. That's about 4,500 people, nursing and midwifery posts. The Public Health Service has lost 10,000 out of its total number, which, by the way, although it makes up only 1/3 of the employment in the public service, the health sector has lost a disproportionate amount of staff. And we're now in the 5th year of cutbacks and contraction for our public health service. And that's why the second issue that will be overarching, I think, all of this conference will be the issue, as Claire says, of patient safety and standards. The professional nurse at the ward, her professional opinion is being ignored by people who could be 100 miles away in an office saying you can't fill. Liam Dorn is gone sick today, you can't fill, so Claire Mahon has to work on her own or work short, or you have 3 instead of 4, make do. Or you'll get someone for 2 hours when you should have had a full shift, or you'll get a healthcare assistant when you should have had a nurse. All of those things, they erode standards in the health system, and I think you'll hear it. You'll hear the phrase mid Staffordshire mentioned in our conference over the next 3 days. And mid Staffordshire was a situation in England where there was a Royal Commission, and it was found there were avoidable deaths, and nursing care was criticised big time. But what was really criticised was that targets became more important than patient care.